on the doula portion. As far as looking for a doula, whether birth or postpartum, I would say ask for references if possible. Interview up to 3 doulas so you can get a feel for that doula, if it's a good fit for your family and for you. If it matters to you, find out if they are certified. Ask what services they provide. Is it what you need for your pregnancy? Are they educated in preeclampsia? What is their background? Do they have other certifications, such as being a nurse, IBCOC, if they're birth and postpartum, asking if they have other certifications, CPR, things of that. As far as, I can't really think of about midwife, but I'm thinking of just the doula portion. That's what I would mainly, and more so than just financial, I would look at the quality of that doula rather than the cost of the doula. Just looking at, like, what do you feel comfortable being around that person? That's the main thing.
I told my husband at the time that I said, you know what, I think I need to go to the hospital. But then I had this 3-week-old baby, and I'm saying to myself, oh my God, let me see if I could, if I just get some sleep, this will work out. Well, I woke up the next morning. Actually, I didn't even go to sleep the whole night because I was in such pain. And about 6 a.m. in the morning, I went to the hospital, the same hospital I gave birth to her, went to Cedars. And they immediately checked me in, and they said, they ran some tests, and they said that you have postpartum preeclampsia. I'm like, post what now? Who? And they said, yeah, you have postpartum preeclampsia. Now, I had never even heard of preeclampsia, much less postpartum preeclampsia in my entire adult life. I don't know anyone who even used that terminology. But once I found out that, so they hooked me up to all this magnesium. I was in the hospital for 3 days away from my daughter. They told me that I was near fatal. They told me that if I didn't bring my blood pressure down, my blood pressure was so sky high. They were so afraid that that I would literally die. They said, you're either going to have a stroke, or you're going to die. And I'm saying, what now? What do you mean? I'm healthy. I just had a healthy baby. What do you mean? And they said, no, your blood pressure is extremely high, and you're at risk. And so they don't even want me to have visitors, because they felt like anyone who came to visit me would kind of ramp up my blood pressure and my excitement. So I literally sat in the dark under magnesium, and for 3 days, and it was very, very scary. And they gave me some medication after, discharging. They gave me some medication, and I started to share my story. And the more I started to talk about it, the more I realized how kind of common this is. And I'm saying, how come you guys never talked about this before? And you know what's interesting to me? The shame that some women felt for even having, something that they couldn't even, they couldn't avoid. And it was really interesting to me that once I started to share my story, how common, even people that were big time executives and celebrities lost babies, with preeclampsia, even during birth. A lot of their children that they had were actually not even their first children. Some of them were their second children, because some of their children died at still, all these tragic stories that I've been knowing these people for years, and they never talked about. So I right away just said, you know what? I don't mind sharing this, because more people need to know and understand that this is a real thing. I was so oblivious to, I thought that I was going to be this light of complete health, healthy, beautiful pregnancy, healthy, beautiful baby. And then my story changed 3 weeks later with postpartum preeclampsia, and it rocked my world. And they told me for 6 months after that I would still be in the high risk stage, that it could happen again, that I needed to, bring my blood pressure. So they put me on Liggett and a few other, and actually Liggett was the only blood pressure medicine that they gave me. And that I needed to just really focus on bringing my blood pressure down. Now I have a blood pressure monitor. I've never had that in my life because I'm healthy. So I'm monitoring my blood pressure, making sure, and it changed my life for the first year. It was very scary, very hard, but I'm glad I survived, just like many of us, and in here to talk about it. But it's such an important topic and an experience that I absolutely did not see coming.
So we know that you are a celebrity makeup artist. Did you feel any stress?
You're talking about like postpartum. Like I didn't work.
No,
No.
oh, you didn't. Yeah, I'm saying even during the postpartum, do you feel like that made the conditions worse as you began to like stand on your feet a lot? I know sometimes they say there's certain conditions that kind of make things worse. Do you feel like your line of work affected you, or do you feel like no, it had nothing? It just totally even caught you off guard? Because, like you said, I know due to our economic status, even me sometimes. We sometimes, or people look at us like we can't be impacted, or different things cannot affect us. So how do you feel it affected you even with your line of work?
Well, I wasn't working. I didn't work. I stopped working right around when I was 7.5 months pregnant. And I didn't go back to work until January or February. So I was off work, thankfully, for, about 3 or 4 months. So the work wasn't the thing. I was a full-time mom. If I may be honest, and since we're going to be here to be transparent, and that's the one thing that he could really identify with, is talking about just, whether it be post-traumatic slave syndrome, interpersonal relationships that we're dealing with within our culture, the dynamics of our relationships with our partners, those kinds of things. And we are least likely to get support and get help outside of our, and so when you're in a home in the four walls with someone who, in a relationship that is stifling you and essentially killing you, it's very difficult to get support outside of that, because quite frankly, not everyone believes what you're going through.
So just talking about your life, what made you come out and share your story, and were you afraid with your platform in sharing?
I do have I guess a public platform in terms of, I do work with a lot of high profile celebrities, and I work with everyday women as well. But I think just the dynamics of working in television gives me a little bit different exposure. But, at the end of the day, I'm a woman. I'm human. I'm a Black woman. I've lived, and I will continue to live. I'm also raising a daughter who will be a woman one day. I want her to live and walk in her truth. I want her to know and understand that, who she is, what she has gone through does not define who she is. I want to be an example to her. And I think that in order for me to be a light, a shining example of Black womanhood to her, I have to continue to not only share the experiences that are not so glamorous. I have a beautiful and a glamorous career, but my personal life is not necessarily that glamorous. And so it's okay to shed a light on that as well, because I feel like when we share our story, we give other people permission to do the same.
Thank you so much. Thank you. We really appreciate you for sharing and accepting our invitation. A very powerful testimony. And before I actually even came in contact with your story, I never knew eclampsia exists. I mean, I was ignorant to the fact that I always thought when to get the baby out, that's it. Everything stabilizes. Get the baby out and everything is fine. So I was really shocked to hear that, oh no, like, wait, postpartum, there's more than just postpartum depression. There's some other things related to postpartum. You have to be really careful. I mean, because they're life-threatening.
They are very life-threatening. And I would say, and I wish that I was here early enough to listen to sort of everyone else's, story. But, one of the things that I would say is that listen to your body. Your body will never lie to you. Your body is telling you. And my ex-husband was saying to me, you're being dramatic. There's nothing wrong with you. You're being, and so, therein lies that dynamic too, where I'm saying, but my body is in pain. you're telling me that I'm being dramatic, but I know my truth. I know what I'm feeling. So never let anyone, make you feel like whatever's happening to you is not your reality or not your truth. Because if you don't listen to that, and which is really God telling, that's really God coming through you and speaking to you, and you have to trust that you're so protected by God enough that your body can speak to you. Don't listen to that noise outside of you. And had I not listened to that, I don't know where I would be, because I literally woke up at 6 and I drove myself to the hospital in that much pain, because my ex-husband saying, you're being dramatic. I don't think that there's anything wrong with you. And I drove myself to the hospital in that much pain. So I think that we just need to, like I said, just listen to our body and trust ourselves and trust that, that's God just protecting us every time.
Back to you.
I want to move on to Jayla. What made you decide to actually share your story or go public with your situation?
So like I said, I'm only 23, and I feel like, preeclampsia, a lot of people think, if they even know about it, oh, it won't happen to me. I'm too young, I'm healthy. I do this, I do that. And I just wanted to go public with it because I want, my generation to know it happens to us too. It's not something that is completely foreign to us. It's common, amongst especially women of color. So I just wanted to bring that awareness to people my age, in my age group, just because, like I said, a lot of people in my age group feel like they're untouchable. So I wanted, especially, women to know this happens. And, how can you, stay ahead of it? How can you, make sure that you're, going to your prenatal appointments, making sure, you're engaging with the people you need to engage with in order to know, in order to educate yourself on these situations that happen, because they can happen to you. So that was my biggest thing on, sharing my story, just making sure, people know that at 23, it happened to me, so it can happen to anyone.
Thank you so much. Thank you. And now we're going to take it to Bruce. Bruce, can you share more about your Save a Rose Foundation? We just would like to hear more just about the mission and the upcoming initiatives you all may have going on.
Save a Rose is still fairly new. Amber passed away about a month ago. So we're still processing everything, but Save a Rose Foundation is looking to stop other women of color from becoming victims of a healthcare system that has failed to uphold their secret oath of medicine. So we're looking to change legislations. We're looking to hold people accountable as if their licenses depended on it. We're also looking to come up with creative ways to offset the costs of, home birth for women. We're trying to make it more affordable. We're trying to make midwifery more accessible. So we're trying to guide Save a Rose, but right now those are our main missions.
Thank you for sharing that. And once again, for everyone, we definitely will promote your organizations. And we also even look forward to partnering with you all, because some of our initiatives are the same. And we know that there is more power with the more of us that unite together and fight against these issues, the more power that we have. And I think that was really why me and Centoria started L.E.N.D.ing, because we also had shame behind medical neglect and things that we dealt with during our actual deliveries. But we felt that it was important that if not us, then who? If we are always shameful and we're not sharing our stories, how can they do research? How can they actually find out what works and doesn't work for us if we are not willing to share our testimonies? So thank you, Bruce. We really appreciate you actually accepting our invitation, and anything that we can do for any of you all to assist you, please let us know, and we definitely will.
Well, dude,
Yeah, I was going to add on to what Jayla was saying. We just always feel like it cannot happen to us until it actually does. And once it does, it's an eye-opener. But I feel like at the end, it's a light, because we turn our tears into a smile somehow. And so that's another reason why me and Sonia decided, okay, we need to share our story. The things we went through has been at least 3 years, 2 years, and we're just now coming out as well. But we feel like the time is now because it's surrounding us with so many people losing their loved ones, losing their lives, losing our angel babies behind medical attention being neglected. So even like the Facebook groups that we're in now, we see so many women going through different things hand in hand because until it actually happens to you or until you really know someone close at heart that's experiencing it, I feel like it's kind of just swept up under the rug. And so, I mean, our platform is really to get us out there and let everyone know, like, there's a lot of resources. We just definitely have to be an advocate for ourselves, our loved ones, and definitely our little babies. So much for sharing your story.
And now we're going to go to Dr. Alisha. And we really are honored to have Dr. Alisha joining us. She is one of our board members for L.E.N.D.ing, and she also is a family physician as well as a pregnancy wellness coach. So for her to have experienced preeclampsia, it was really interesting, and especially with her being a doctor, still feeling like there could have been other precautions and things taken. So Dr. Alisha. Oh, I don't see her. Is she here?
Yeah, I'm here. I'm here.
Okay. So
yeah.
we had a few questions for you as well, because we know that you're a doctor, but you're also a pregnancy wellness coach. Are there any holistic things that can be done, or I mean, like diet or exercise that can be done prior to pregnancy or while you're pregnancy that can kind of reduce this medical condition? We know it could just come on you at any time, but are there precautions that should be shared with women, like diet and exercise and things?
Yeah, so I mean, there's definitely things that women can do to reduce their risk, but even with those measures, there's no guarantee that you won't have preeclampsia, right? Like the research basically shows that, you know, women who are obese, women who have hypertension, women who are diabetics prior to their pregnancy or develop gestational diabetes, women of color, there are certain risk factors that do confer a higher risk of getting preeclampsia. So, you know, you can try to mitigate your risk, it's true, by trying to make sure your blood pressure is controlled, by, you know, exercising, by having a healthy diet, but those things don't necessarily guarantee that you're not going to have preeclampsia, right? I would say the most important thing is, you know, having agency. So that means that, you know, making sure that when you go to your doctor's visits that you understand everything that's happening to you, that everything that your doctor is ordering for you, that you understand like what a blood pressure means, why they're taking your urine, asking those questions. And I think really coming in prepared is super important. As a doctor, I understand that there's a lot of pressures from the healthcare system on practitioners to really move as quickly as possible through patients, because unfortunately we work in a fee-for-service system where really quantity is prioritized over quality. So mistakes get made, you know, and it's an unfortunate byproduct of the system, the healthcare system that exists in this country, which, you know, we should really move toward a single payer system to eliminate that stress. But you know, in terms of advocating for yourself, it's just super important. It's super important to walk in with knowledge. It's super important to walk in with questions. And that's why it's so important for forums like this, for women to share their stories so that people can then take those stories to their doctor and ask, like, well, what's my risk? What can I do? You know, how do my health conditions, you know, affect my risk of having a healthy pregnancy or having complications in my pregnancy? Because unfortunately with a 15-minute appointment or 10 minutes, when there's just so much that you need to cover and things that you need to do and information that you need to give, a lot of times those things get lost. So it's super important for patients to come in with that agency and say, this is important to me. I want to talk about this, you know, or bringing a family member, bringing a friend, hiring a doula, bringing the doula with you to your appointments if you can, or, you know, just being able to understand that this experience is not something that we should go through in isolation. You know, in traditional cultures, traditional African and Asian cultures, Women have always given birth in, communal. You've always been, surrounded by groups of women that support them, that encourage them. It's in our culture that women have to go through this process in isolation, which I think kind of contributes to the shame and contributes to the secrecy around the medical conditions that we all face. But, as I mentioned with my story and having preeclampsia and having a pretty fairly good pregnancy, even though I was a diabetic and it just came on so suddenly, still feeling like even myself, I needed an advocate. Because we are vulnerable during that time. You're carrying a child. There's so many emotions going on. There's family dynamics that are changing, financial dynamics that are changing. People are concerned about, insurance coverage and bills that may pile up after delivery. So many changes and forces at play that you don't realize that you are vulnerable during that time, and you need someone to advocate for you if you're not able to advocate for yourself. So I would say those are like the most important things, like for women to walk into their visits armed with information and agency. Super, super, super important. And unfortunately, there may be pushback, and I don't know if people have experienced this, where doctors are, will blow you off and will, some doctors don't like. I'm one of these people, I love when patients come in with information that they Googled and printed. I'm like, oh, show me what you got.
Yes.
But a lot of people, the medical system is very patriarchal. So people operate in this mindset where, well, I know best because I'm the doctor, so I'm not going to listen to what the patient has to say. And then you can just find a new doctor. You can always change. You can always request your medical records and move on to the next person. You can always get a second opinion. There's so much support out there now on Facebook. Even if it's not necessarily a doctor, you're just like, is this something that is weird or not weird? You can always use those forums with women like yourself as a sounding board, because, as women of color, we'll chime in and be like, yep, that's weird. That's weird. Like, you need to find another doctor. But that's why it's so important for us to have, the Save a Rose Foundation and other organizations like L.E.N.D. who can provide a forum where women can speak about their experiences, because it's just super, super, super important.
And with you being a physician, do you have any recommendations for treatment during the COVID pandemic, especially if you're pregnant? Because I know being pregnant is already scary, but then what recommendations do you have for women that may be afraid and feel like that the hospital is just like a hot spot?
Well, it is, especially if you're in New York City. I would definitely try to avoid that place, like the plague, because there is a plague. I feel like the whole telemedicine thing has really complicated, especially it's complicated prenatal care and complicated healthcare in general. It's been good in some respects and not so good in other respects. So it's been tough, I think, because many organizations have had to really quickly adjust to this new reality, and, making decisions without necessarily seeing patients can be tough. But I would just go back to the same thing, like having that sense of agency, really pushing, really asking the questions, probing, having advocates on your side that ask questions also. And not just kind of leaving the decisions to the doctor, like really, wanting to be a part of decision-making processes as well. It's been a really complicated time, unfortunately, just because, so much has just kind of been thrown together in the healthcare system. This is not something that anybody was prepared for, the COVID pandemic, and it's completely changing the face of healthcare in this country, and how we deliver care. So it's really complicated, unfortunately. I think we're all still learning what's kind of the best way to deal with this whole new telemedicine reality.
Okay, but at this time, we're going to open up the forum for any questions that any participants may have. Can you please put them in the actual chat box if you have any questions?
Or if you don't have any questions, to our panelists, if you can give any advice, you can just unmute yourself. Any advice you would like to share for people who's going through pregnancy, pre-pregnant, just to help them a little. And that can be open to anyone.
for Dr. Alisha to come back on really briefly and speak about the birthing center that her friend is actually about to open as well.
It's maybe even the same, because I mean, I can't imagine there's 2 birthing centers opening in the Bronx, so it's probably the same group of people. But yes, so there is. I have a very dear friend who's actually my doula, who I trust implicitly, who is spearheading an effort to open a birthing center in the Bronx. The hospital is just really one option for delivering your child. There are other options, and women should really be presented with all of those options. Bruce mentioned a midwife, so certainly, you can certainly reach out to midwives as well. Generally, midwives take care of lower risk women, so women who have any health problems, unfortunately, likely won't be able to be followed by midwives and have that experience. But that's definitely an option for women who are healthy, who are otherwise healthy. So yeah, this birthing center, hopefully, it's at the very beginning stages, but currently there's so few birthing centers in New York City. I think there's only one, as Bruce mentioned, and there used to be one in Manhattan attached to Mount Sinai, but that closed last year. So yeah, providing more birth options is super, super, super important.
One of the things that one of the best things that I did postpartum was I actually hired a postpartum doula. And it was one of the best decisions that I ever made, because that postpartum doula was with me when as soon as I got to the hospital to check in for my preeclampsia. She was there with me, and she was also helpful in taking care of my baby, because my husband at the time was at work. So she really filled in the gaps for me. And then when I came home, she made me these tea baths. She gave me massages. She really cared for me in a way that no other healthcare professional would be able to do. And it's, one of the best investments that I ever made was in my postpartum doula.
We also have one more question before we close out. What do you recommend pregnant women to look for as early signs of the preeclampsia? And that's going for like prenatal visits and when you're actually going to your appointments, if anyone can address that.
Sure, I can answer that question. So, as everyone's kind of telling their stories, people can kind of hear what are some of the symptoms that we all experienced. But generally, definitely elevated blood pressures, which is why it's good to have a blood pressure cuff at home, which we should all have anyway, just because it's just super important to know what your blood pressure is. Definitely weight gain. Usually with pregnancy, there's a trend in weight gain. And so if you find that you're gaining weight very quickly, that's just kind of outside of your trend, that should really raise a red flag. And oftentimes swelling and weight gain and fluid retention, even though it is normal in pregnancy to have those things. But, like I said, outside of your trend can be a red flag even before some of the other things come up. So that should be something that's like, okay, well, I gained 5 pounds in 1 week. I should probably get a blood pressure cuff and bring this issue to my doctor. Other things, pain, as Melissa mentioned, it's usually in the right upper quadrant. You can get pain, headaches as well. Blurred vision is another one. Swelling in the face, which is what I had, because swelling in the face is generally abnormal for pregnancy. You'll get swelling in your legs, sometimes in the hands, but even still in the face is not normal. And, usually it's around the eyes. So that's also something to look for. And then all of the other parameters are usually laboratory parameters. So once those, you actually get to your doctor, they should run some blood tests on you, check your urine, check your blood pressures frequently, and let you know if you are someone who's experiencing preeclampsia.
Thank you.
One of the things that one of the best things that I did postpartum was I actually hired a postpartum doula. And it was one of the best decisions that I ever made, because that postpartum doula was with me when as soon as I got to the hospital to check in for my preeclampsia. She was there with me, and she was also helpful in taking care of my baby, because my husband at the time was at work. So she really filled in the gaps for me. And then when I came home, she made me these tea baths. She gave me massages. She really cared for me in a way that no other healthcare professional would be able to do. And it's, one of the best investments that I ever made was in my postpartum doula.
We also have one more question before we close out. What do you recommend pregnant women to look for as early signs of the preeclampsia? And that's going for like prenatal visits and when you're actually going to your appointments, if anyone can address that.
Sure, I can answer that question. So, you know, as everyone's kind of telling their stories, people can kind of hear what are some of the symptoms that we all experienced. But generally, definitely elevated blood pressures, which is why it's good to have a blood pressure cuff at home, which we should all have anyway, just because it's just super important to know what your blood pressure is. Definitely weight gain. Usually with pregnancy, there's a trend in weight gain. And so if you find that you're gaining weight very quickly, that's just kind of outside of your trend, that should really raise a red flag. And oftentimes swelling and weight gain and fluid retention, even though it is normal in pregnancy to have those things. But, you know, like I said, outside of your trend can be a red flag even before some of the other things come up. So that should be something that's like, okay, well, I gained 5 pounds in 1 week. I should probably get a blood pressure cuff and bring this issue to my doctor. Other things, pain, as Melissa mentioned, it's usually in the right upper quadrant. You can get pain, headaches as well. Blurred vision is another one. Swelling in the face, which is what I had, because swelling in the face is generally abnormal for pregnancy. You'll get swelling in your legs, sometimes in the hands, but even still in the face is not normal. And, you know, usually it's around the eyes. So that's also something to look for. And then all of the other parameters are usually laboratory parameters. So once those, you actually get to your doctor, they should run some blood tests on you, check your urine, check your blood pressures frequently, and let you know if you are someone who's experiencing preeclampsia.
Thank you.